çka ne evidentuam ishte prishja e rutinës së përditshme të pacientëve për të zbatuar sidomos ato këshillat që rekomandonte OBSH-ja. Të smurët kishim një agravim të psikozave të tyre, por ajo dukuria më e shpeshtë ishte mbi vendosja e çrregullimit të ankthit. Qytetarë të zakonshëm që ju prisheshe ajo rutina e përditshme dhe trokisën e dyert e qendrës komunitare me problemet të ankthit, të padurimit, të irritabilitetit, të ngatmueshmërisë, prishje të gjumit, kështu që patim një shtim të nozologjisë të çrregullimit të ankthit. Angazhuam më shumë profesionistët e shëndetit mendor, psikologët, punëtorët social, infermierët për të afruar shërbimet e tyre në ku ishte mundur në shtëpitë e tyre, pranë banesave, ose nëpërmjet komunikimit virtual.
COVID-19 bëri që të kishim vështirësi lidhur edhe me atë që duhet ju tregonim këtyre pacientëve se çfarë po ndodh të realisht. Kështu që zgjodhëm që të punonim me turne njësoj si në ditë të zakonshme pa situatën që vërtet po e përjetonin të jashtëzakonshme. Piqeshim sa mundeshim që të sillnim këtu staf ose personel të jashtëm për të marrë analizat në rast se do kemi një vazhdim të situatës pandemisë brenda spitalit rajonal, të krijohej një ambient ku këta banorë të ishin të trajtuar dhe të izoluar së bashku me pacientët e tjerë.
Unë kam jetuar këtu në shtëpinë në mbështetje, pastaj u largova, jetoj me gruan. Në kohën e pandemisë zvinja shpesh këtu. Kishim pak frikë në fillim. Pastaj u mësuam, zbatonim ato rregulla që kishin japin doktorët në televizor. Ajo periudhë më mërziti sa më tepër, se nuk ishim mësuar që të rinim mbyllur në shtëpi. Edhe kështu avash avash u jetuam.
I hope the video you just saw has paved the way for the focus we are now going to give to mental health. And the relevant documents are presented here on the screen. Do we have them here? I believe that in the past 18 months, all of us, in one way or another, as health policymakers, health professionals, private citizens, parents, family members have been affected mentally by the unprecedented changes to the way of life as we knew it until then. This session will aim at turning this awareness into an opportunity to address long-standing systemic problems and deficiencies in mental health services. The evidence that is being built on the mental health impacts of COVID-19 is driving a renewed interest and commitment to mental health, as many of us witnessed during the Athens summit on addressing mental health conditions, promoting mental well-being and strengthening resilience amidst the COVID-19 pandemic. In this session, we will have a statement by the regional director, a keynote presentation, a multi-stakeholder panel, and open discussion and adoption of the proposed resolution. I will introduce these in order as we go through the program. Let us therefore listen to the call by the regional director. The floor is yours, regional director, please.
Thank you very much, Executive President. Ladies and gentlemen, nearly 2 years into the pandemic, life is unrecognizable for many. Millions have lost their loved ones. Many are still struggling with the job and all of this creating a deep wound in our collective psyche. Healing will take time. Added to the often extreme changes to our life as we once knew it, physical distancing, isolation, school closures, lockdowns have given rise to a host of and the us for a long time to come. Fortunately, we know what needs to be done, but we need to act today. Our European Programme of Work is a blueprint for action. We need to work together to make sure we leave no one behind. While mental health has always been a priority for WHO Europe, the pandemic has clearly shown how much the region has struggled with providing quality mental health services. We continue to see gaps in treatment and capacity, in evidence and knowledge, in quality and safety, and in upholding human rights. Closing these gaps means rallying political commitment, finding resources, and pushing the boundaries for innovation. Innovation that the European Framework for Action on Mental Health 2021-2025 clearly lays out with 3 core priorities in line with the EPW. How do we mobilize this? How will we move from the what to the how? My proposal is the Pan-European Mental Health Coalition, which I ask you to join, promote, and make your own as a vehicle towards better mental health for the people of our region, because mental health matters.
Thank you, Regional Director, for your inspired words. This committee takes note of the priority you had already given to mental health in the EPW prior to the pandemic of COVID-19. What happened in the last 18 months proved how that was the right decision in the right time. I am now inviting Dr. Natasha Atsopadi-Muscat, Director of Country Health Policies and Systems in the WHO Regional Office for Europe, to present the new European Framework for Action on Mental Health, and then Dr. Ledia Laseri, Regional Advisor for Mental Health, to lead the following multi-stakeholders panel. Please.
Thank you, Madam Chairman, Your Excellencies and colleagues. So as we have heard already, the COVID-19 pandemic has had a major impact on mental health. It was for this reason that at the beginning of this year, WHO Regional Office for Europe set up a technical advisory group in order to evaluate the situation, but more importantly, to advise us on the actions that needed to be taken. And the report of the technical advisory group is available as a background document and was launched at the Athens Mental Health Summit held in July. In a nutshell, this report found that everybody was impacted somehow or another. We know firsthand our children, our parents, our peers and colleagues, all of us have witnessed experiences where people who had never been previously affected by mental health illness had symptoms for the first time. But the second message is that not everybody was equally affected. Those who already had pre-existing conditions, those who were already marginalized in society, refugees perhaps, or migrants, or people who are living already in poverty or difficult situations, felt the brunt more. Those who were already vulnerable became more vulnerable to mental health effects during the pandemic. And of course, we know that mental health services were amongst the most disrupted. So at a time when we had the greatest need, we had quite a large amount of services disrupted. All of this came when we already knew that our services in Europe were struggling to meet the increasing needs and demands pre-pandemic. So, what is the next step? As our regional director has just said, we are proposing a European framework for action on mental health, very much structured in line with the pillars of GPW 13 and the EPW. So the first pillar is about transforming services to improve universal health coverage. And this places a strong focus on mental health in the community, on mainstreaming mental health services into general health services, on deinstitutionalization, on strengthening the long-term care and support. The second column, however, is really about ensuring that mental health is part and parcel of the preparedness and response. In future emergency situations, mental health services should be amongst the last to be disrupted and should be considered on the same basis, for example, as we have seen life-threatening surgeries, which were understandably amongst the services least disrupted. Why? Because we know that in an emergency, particularly in a long and protracted emergency, the need for mental health services is larger than ever. And the third pillar, if we want to really build health and well-being, there is no health without mental health. And here again, we focus on mental health through the life course, but our experience from the pandemic has shown that children, adolescents, and older persons have really borne the brunt. And therefore, in going forward, we need to ensure that these groups are prioritized. How will we do this? We intend to implement the European Framework for Action together. It is too large a job for any single organization to take forward. And this is why on the 30th September, we will be starting and we will be launching the Pan-European Mental Health Coalition. For this, we invite all technical focal points within member states to be active, to contribute, and to ensure that the work that we are doing at regional level really reaches the countries, to listen to your needs, to enable you to work together, as we have heard that in the journey to transform mental health services, to place mental health at the heart of all policies, working together and learning together can be supportive. And we can all learn from each other. North, south, west, east, sharing our experiences makes us stronger. Of course, we will continue to rely on the technical advisory group so far in the next phase of this journey, on our excellent network of WHO collaborating centers and academic centers, and on our trusted partners, accredited non-state actors active in public health and in mental health. However, the coalition intends to go further, because let's face it, all of us who were already advocates for mental health prior to the pandemic unfortunately realized that mental health was not where we wanted it to be. And therefore, this is really the moment to make mental health everybody's business and to bring non-traditional partners also around the table. What will the coalition do? The coalition will seek to transform. That is a verb. It's about action. So, to transform attitudes about mental health and well-being, of course to work on stigma, but really going beyond to deepen the understanding of mental health and to ensure that mental health is something, as we heard yesterday from those brilliant young children who opened our regional committee, that people are not afraid to talk about. To transform mental health services and increase the coverage. And of course, this will require work in all the traditional health systems pillars. It also means that we need to bring mental health services out from the periphery and into the center. And earlier today, we heard many of you mention mental health in your interventions on primary healthcare, and that is very heartening. But in order to do this, we need advocacy. Why? Because we need really to transform the amount of investment that we put into mental health, not only into curative services, but into mental health policies that promote well-being, including, for example, at the workplace, as many people now seek to find a new balance with new realities also as they return to work post the experience of the COVID-19 pandemic. So coming to the end, I conclude where I started. And what we want to do is we want to bring mental health out of the shadows, whether this is in the health services, hospital services, primary care, whether this is in our workplace, in our schools, in sports, in culture, in our homes, in our communities. In order to do this, we need to build leadership and advocacy at all levels. And here we invite you really to join and partner with us in the Mental Health Coalition. But secondly, we also need to make mental health visible. And we recognize at the moment, and you will hear more about this in the final session later today on the measurement and evaluation framework for the EPW, that mental health, albeit its importance, is still not visible enough because we do not capture it well enough. What can't be measured can't be made visible, can't be managed, and we want also, hopefully, to be able to measure our progress and to look back a few years from now and see that we have made strides in this area. So thank you very much, and that's all in terms of the presentation. And perhaps I can ask the technical colleagues to show our video from the Athens Mental Health Summit.
The promotion of mental health, especially taking into consideration the impact of COVID-19, is of utmost importance. Healthy people are not just the people who are free of physical ailments.
I think that we are really at a turning point for mental health. The coronavirus infection has demonstrated how fragile is the asset for mental health, particularly for community services.
We as countries need to adjust our policies and make everything possible to provide a quality of care to our patients, to our population.
В обстоятельствах принятие декларации Афинского саммита представляется особо важным. Направление нашей работы дальнейшей – это закрепить в ней, включая важность управления первичного звена, здравоохранения, раннего выявления и профилактики психических расстройств, представляют собой основу и составляют наше общее видение решения проблемы.
We need to make sure that we grab this opportunity and we continue to give the importance that mental health service everywhere need.
The best political strategy to ensure quality of care is to render our mental health systems more holistic and human-centered.
En este encuentro hemos pasado del silencio al debate. Ahora nos corresponde pasar del debate a la acción. Necesitamos saber cuáles son las mejores prácticas que están llevando a cabo todos los países de nuestro entorno y más allá.
It's only by addressing mental health issues that we will be able to provide this holistic, European, anthropocentric response.
With your permission, Madam Chair, I will now hand the floor to Dr. Lydia Lazzeri, our Regional Advisor for Mental Health.
Thank you, Dr. Azafardi Muscat. With me in this panel are Mr. Neil Kelders, a coach and advocate for mental well-being from Ireland, Ms. Zoe Rapti, Deputy Minister for Mental Health in the Ministry of Health of the Hellenic Government, Mr. Frank Bellivier, Minister Delegate for Mental Health and Psychiatry for the Minister of Health of France, and Dr. Claudia Marinetti, Director of Mental Health Europe. I have now the pleasure to start this panel by giving the floor to Neil Kelders. Neil, you have been able to transform your own experiences into inspiration for others. And by joining us in this panel, what would you expect from a platform like the Pan-European Mental Health Coalition, and where you would like to see the European mental health community in 5 years from now?
First of all, I would like to make a bold statement and say that my mental health problems have had actually a positive impact on my life. For one, I'm sitting here in front of you speaking about my mental health problems. Imagine if we could get other people in 5 years' time making such a bold statement. It is possible, just look at me. In April 2014, there's a day that I say is the day that saved my life. And what I mean by that, it's the day I revealed about my mental health problems, my struggles. For the 21 years before that, since I was 15 years of age, nobody knew. I suffered in silence and I suffered alone. And this can't happen anymore. 21 years is too long. I was afraid to talk. I masked my mental health problems. I was afraid because you would judge me. I was afraid how you would look at me. I was afraid how you would think about me after that. And I fully didn't understand what I was going through. So I couldn't relay that to you. I was the outgoing guy, the strong guy, the sporty guy, the social guy. Externally, the go-getter, the confident person. But internally, I was in turmoil. You know, and I'm not alone in this. There's 125 million people in our region struggling like I did. But I have to say, I think there's a lot more. Because if you think about it, I was never a statistic. Nobody knew about me. There are many more people out there like me. We have to find them. We have to help them. We have to show them it's okay to talk again and again and again. We need to believe in them. We need to give them the strength, the confidence, and the tools to shine and to live the life that we all deserve to live. You know, I work with a lot of companies, a lot of government agencies, and after sessions of mental health or well-being, I ask them all the participants one question, and that one question is, what is your number one question on mental health and well-being? And I have hundreds of responses, a variety of replies, but the main question that keeps popping up is the question, how can I help someone who is struggling? And that tells me two things. That tells me people want to help people. They don't know how to. We can help them with that education and information. We can help them with their own mental health and well-being. The second thing that question tells me is that a lot of people asking that question are hiding behind the question. They're asking for themselves because still they are afraid to speak out because we will look at them as weak. We will judge them. So what I want to ask you is, as an individual, how can you help those people? What steps can you take to help your people? What steps can we take as a coalition to help individuals to maintain good mental health well-being from the cradle to the grave and to bring those people out of the shadows? And that is very, very important. Okay, we need to be able to help people, as I coin it, win from within, where they can help themselves eventually. I want to thank you very much for letting me speak, and I'm really excited to see what this coalition has lying ahead. Thank you very much. My name is Neil Kelders.
Thank you. Thank you so very much, Neil, for sharing with us this empowering and inspiring journey. And I hope it will offer food for thought and reflection for all of us in this room and for enabling us to reach where you called us to go. Now, with us in this panel is Ms. Zoe Rapti, Deputy Minister for Mental Health in the Hellenic government. And Ms. Rapti, we just watched the video from the Athens summit on mental health impacts on COVID. And in the statement for this video that we just heard, you called for political action towards human-centered care. In view of the commitment of the Hellenic government to support the mental health and well-being of children, adolescents, and young people as one of the key signature initiatives of the Framework for Action on Mental Health, I'd like to ask you, as the Deputy Minister of Greece, what is the political action you are taking to reach this dimension of the framework? Over to you, Ms. Rapti.
Thank you very much, Your Excellency, WHO Regional Director for Europe, Dr. Kluge. Dear colleagues, dear all, thank you very much for inviting me to participate in this important session on mental health towards the adoption of the WHO European Framework for Action on Mental Health 2021-2025. It is a great honor to work alongside with my colleagues from other member states on the crucial matters of mental health. And therefore, I would like to congratulate WHO Europe for putting mental health at the heart of the matter. Important steps have been taken to anticipate and map the needs of children and adolescents in Greece. In collaboration with WHO, we conducted a joint review of the current state of mental health services within the aim of developing a set of recommended actions that will contribute to the improvement of the mental health system in the country. Among the findings of the review, the need for services specifically for children, adolescents, and young adults were especially showcased. This joint review led to the creation of the National Mental Health Committee, the members of which were assigned to work on the National Mental Health Action Plan for the next decade. The action plan consists of 10 axes, and one of them makes a deep dive on mental health of children and adolescents. The pandemic has brought sweeping changes in all people's lives in a way that put us all in a survival mode. Children have been particularly affected by the impacts resulting from school closures. The COVID-19 pandemic has further highlighted the need for a people-centered, high-quality, and stigma-free health system which meets the unique needs of children and adolescents. To respond to these challenges, significant steps have been taken by the Greek government during the COVID-19 pandemic. The hotline for psychosocial support to COVID-19 patients, which is free of charge and was expanded to support children. Mental health facilities are being established for children and adolescents aimed at both prevention and provision of care. And finally, in collaboration with the Stavros Niarchos Foundation and the Childmind Institute in New York, we are realizing a 15 million euro 5-year program, especially looking at child and adolescent mental health. Thank you once more for giving me the opportunity to address this panel on this very important matter.
Thank you very much, Ms. Rapti, and I suppose you, by your comprehensive answer, you also paved the road to the Mental Health Coalition, because especially at the end of your speech, you also informed how you are working in collaboration and partnership with other organizations. So thank you for this. Now I'd like to pass the floor to the representative of another country that has shown great leadership in fostering international collaboration for mental health. Professor Bellivier, who is the Minister Delegate of the Minister of Health of France, is chairing the task force that is behind the organization and the preparations of the Global Mental Health Summit, Mind Our Rights Now, that will take place in Paris on the 5th and 6th of October this year. Professor Bellivier, can you please share with us the rationale France adopted when deciding to support such a summit? And how can the Pan-European Mental Health Coalition be empowered by such global interest? Over to you. We don't hear you. No, can I ask the technical team to help us with? The technical team says that it's your issue and you have to select audio. If you can try once again. Otherwise, we pass to the next speaker and we return to you. Okay, so let's go to the next speaker. Dr. Claudia Marinetti is the Director of Mental Health Europe, that is the largest independent network organization representing mental health users, professionals and service providers across Europe. As an organization of a rather diverse representation, how can you contribute to the work of the Pan-European Mental Health Coalition and ultimately to the implementation of the framework for action that is under discussion today? Over to you, Dr. Marinetti.
Thank you very much, and thanks for this invitation. It is an honor to be part of this panel. Thanks also for the introduction. For those of you who do not know us, Mental Health Europe is indeed the largest independent European non-governmental network committed to the protection of the rights of persons with mental health problems and psychosocial disabilities, the promotion of positive mental health, the prevention of mental health distress, and the improvement of care and social inclusion. And we act as knowledge brokers and as a hub for learning exchange and concerted action to improve policies and practices. And our members are associations, organizations, and individuals that are active in the field of mental health and well-being in Europe, mental health professionals and service providers, and human rights experts. For over 35 years, we have been working closely with international bodies and the European Union institutions to mainstream mental health in all policies and end mental health stigma. Altogether, we strive to ensure that everyone can enjoy the highest attainable standard of mental health and that persons with mental health problems can live fulfilling lives. And there are many ways in which Mental Health Europe can contribute to the delivery of WHO Europe strategic objectives for mental health via the Pan-European Mental Health Coalition. And one of the strengths of Mental Health Europe is that we have bringing together from the start many key actors in the mental health field. And thanks to their varied expertise, we are uniquely well placed to feed into and to enrich the work of the Mental Health Coalition and apply this at national and at local levels, including through engaging with policymakers, authorities, and other actors. And our members are also keen raising awareness and ensure that more stakeholders are informed about, but also engage with the work of this flagship initiative. Mental Health Europe is specializing in co-creation, which fosters equality-based partnerships between expert by experience, their supporters, service providers, policymakers, and other actors. And we have expertise in bringing different stakeholders together, also beyond the usual interlocutors, to find solutions to the most pressing issues in the field of mental health. We also work very closely with the EU institutions. We coordinate the European Parliament Coalition for Mental Health and Wellbeing and the European Commission COVID-19 Mental Health Support Network. And we have launched the European Mental Health Awareness Week. Collaboration with these different initiatives can help promote mental health and as a critical priority for public health across the European region. This flagship initiative will be crucial to mainstream, promote, and safeguard mental well-being as an integral element of the COVID-19 pandemic response and recovery, but also to counter the stigma and discrimination associated with mental health problems and to promote investment in accessible quality mental health services. The work of the coalition will add to the efforts of different stakeholders through the European region, and it will help closing the persisting gaps in mental health so that no one is left behind. So we're truly looking forward to being an active partner with the Pan-European Mental Health Coalition. Thank you.
Thank you, Dr. Marinetti. We are equally looking forward to work with you starting from the 30th of September upon the launch of the Mental Health Coalition. I'd like to go back to Professor Bellivier and take his statement. His answer to the question. Professor Bellivier, can we try again? No. I am afraid. I'm afraid we will have to. We'll have to negotiate if you can take the floor during the member state statements and try our luck later on. For the moment, on behalf of the Secretariat of the other panelists, I thank you, Professor Bellivier, for being with us, and we hope to hear you during the statements of the member states and to hear more about the Global Paris Summit. Thank you. I now hand over to the chair.
Thank you, Dr. Alcibiades-Muscat, for your nice presentation and Dr. Lazeri for the effective moderation of the panel, and I join you in thanking the panelists on behalf of this committee. And we try to solve the problems with the microphone. I just told to the regional director that coming from a government, we have also problems by taking Zoom connections from government platforms. The firewalls are securing so that sometimes you can't get your voice through those connections. But we try to find out ways, if that is possible, to get also Professor Bellivier's message through. But I now open the floor for member states and accredited organizations to express their comments on the framework for action. And please focus on the working document of the framework for action and the accompanying resolution which you are asked to endorse. And again, we start with those registered on the pre-established speakers list. And first, I would like to give the floor to Slovenia on behalf of the EU and its member states, followed by Turkey and Azerbaijan. And Slovenia, now you have the floor.
Honorable Chair, the Regional Director, Excellencies, colleagues, I have the honor of speaking on behalf of the European Union and its member states. The candidate countries of the Republic of North Macedonia, Montenegro, and Albania, as well as Ukraine, the Republic of Moldova, Armenia, and Georgia align themselves with the statement. Excellencies, even before the COVID-19 pandemic, mental health was a major public health concern in our region, with over 125 million people estimated to be living with mental health conditions, equivalent to 13% of the population. Even if the longer-term implications of COVID-19 pandemic cannot yet be fully assessed, it is already obvious that mental health problems are being exacerbated by economic and social insecurities due to the crisis, and that there will be significant and sustained impacts on people's health and well-being. Mental health must be at the focus of all attention, especially for young people and vulnerable populations, and put at the center of our COVID-19 recovery plans. This includes ensuring the place of mental health in global health national and international policies and the implementation of existing international standards and conventions. To achieve this goal, greater investment in mental health services is needed now. There is also a strong need for well-trained mental health staff. We need to target our attention to vulnerable groups, health workers, young and marginalized people. We also need to address the situation of patients with mental health disorders and comorbidities or other serious health risks, such as substance abuse problems. Excellencies, we fully support the European Framework for Action on Mental Health, covering the period 2021 to 2025 and its 3 strategic priorities, moving towards universal health coverage through the transformation of mental health services. In particular, the need to ensure the highest quality of mental health care is addressed holistically and with a focus on primary health care. Secondly, integrating mental health into preparedness, response, and recovery from crises and emergencies. This could be broadened to take into account the distress caused by climate change and most recent disasters, such as forest fires and devastating floods. Third, promoting mental well-being throughout the life course, in particular reinforcing strategies to promote patients' and families' empowerment and self-determination, and ensure promotion of rights in mental health services and recovery-based approaches. Beyond these 3 strategies, collecting better data on mental health systems and on the mental health status of populations is crucial. We support the creation of a new monitoring and evaluation framework using existing but also new indicators. A mental health data lab to be set up by the WHO Regional Office for Europe should facilitate this. In this endeavor, we ask the Secretariat to show restraint so as to limit the burden of reporting on member states to what is absolutely necessary. The Mental Health Coalition can be a key instrument to achieve the objectives of the European Framework for Action on Mental Health. The EU and its member states therefore call for strong support to the upcoming Mental Health Coalition to be launched on September 30th. Thank you.
Thank you, Slovenia. Now I give the floor to Turkey, followed by Azerbaijan and Portugal. Please, Turkey, the floor is yours.
Thank you, Chair. Distinguished delegates, first of all, I would like to thank the Secretariat for their comprehensive work and valuable effort for this final report. As we all know, the COVID-19 pandemic has had negative effects in the area of mental health, including other health problems. To mitigate the burden of COVID-19 and mental disorders, mental health and well-being of people around the world should be improved. It is essential to promote investment in accessible and quality mental health services. In this context, we welcome the flagship initiative of the European Programme of Work, namely the Pan-European Mental Health Coalition. On the other hand, it is essential to review our mental health policies in our countries to promote and safeguard mental health well-being in the COVID-19 era. As we all know, accessible, community-based mental health continuity of care, wide-ranging services that respond to different needs of the population has an importance. And these services should be integrated into PHC services. In this context, community-based mental health services have been started in Turkey, and preventative mental health services are provided through centers designed as primary healthcare facilities since 2006. In addition, we adopted policies to reorganize and strengthen the response capacity of mental health during the COVID-19 pandemic. In this regard, Turkey has established psychosocial support lines in order to provide support for protecting the mental health of people who suffered from COVID-19. Virtual psychosocial support services have been put into practice through telemedicine technology. This includes telemonitoring people with COVID-19 suspicion, remote surveillance of the symptomatic people's clinical picture, and isolation limitations in terms of mental care. We appreciate the Secretariat's emphasis on the mental health issues neglected during the COVID-19. We believe that resolution on the WHO European Framework of Action on Mental Health 21-25 will be very useful. With this in mind, we support relevant works. I thank you.
Thank you, Turkey. And now I would like to jump back to the panel because we think that we have now got connection to Professor Bellivier. So I would like to give him the floor here to hear his message before we continue the statements of our honorable delegates. Professor Bellivier, the floor is yours.
Thank you, Madam Chair. Can you hear me well now?
Very well. Continue.
Okay. So thank you, Madam Chair, distinguished delegates and colleagues. In the context of the establishment of a pan-European mental health coalition, I am delighted that you offer me the opportunity to present the perspectives that France wishes to bring in terms of mental health at the national and international level. France clearly supports international initiatives such as the Pan-European Mental Health Coalition proposed by the WHO, Euro, and we are very committed to organize on the next October 5 and 6 with the support of on mental health. After London 2018 and Amsterdam 2019, the Paris Summit entitled Mind Our Rights Now will focus on rights in mental health. Indeed, we are convinced that right-based approaches are important levers to help transforming mental health services. Obviously, the Paris meeting will be also dedicated to share lessons from the crisis. Our ambition is to make the Paris meeting one more milestone to support an annual meeting between representatives of the civil society, associations, professionals, persons with lived experience and policy making. This way, shared views and a common culture on mental health and psychiatry may emerge. These, in turn, are likely to accelerate changes to improve mental health services and promote good practices together with an increased involvement of governments. Several personalities have already confirmed their participation to the Paris Summit. Following this idea, during the Paris meeting, we will work on how to structure the organization of this recurrent annual meeting, encourage progressive commitment of stakeholders and countries, and organize a rotating leadership. For the sake of continuity, the French Health Ministry proposed to stay engaged in the post-summit period, including cooperation with the country that will host the next meeting. Because several European countries are already strongly committed to improve mental health services and to lead changes and reforms, the creation of a pan-European mental health coalition comes at the very right time to structure transnational cooperation and make Europe one of the leaders at the global level. On that regard, we may expect a strategic role of the coalition to make an annual global meeting on mental health a success in the coming years. The key messages I wanted to deliver today: maintain international mobilization to help national changes, promotion of right-based policies and increased interaction between policymakers, international standards, and actors in the field to facilitate concrete action and to lead changes. Investment is also critical for mental health. Overall, we are convinced that this mobilization is likely to prioritize national investments. The EU for Health program should also include a mental health pillar. Thank you for your attention. I look forward to seeing you in Paris, either in person or online. Remember that live broadcast of the summit has been organized and streaming afterwards will be also available. Please help us to spread the ad widely.
Thank you, Professor Pellivier, for your work, valuable work. Now we go back to our delegates' statements. And I have here next Azerbaijan and followed by Portugal and Greece. So I will give now floor to Azerbaijan.
Dear Chair, dear Director General, dear colleagues, ladies and gentlemen, adoption of the Comprehensive Mental Health Action Plan 2013-2020 by the World Health Assembly had significant impact on the development of mental health policy and services in Azerbaijan. For the past 8 years, within the framework of the Mental Health Action Plan, we launched a large-scale reform, resulted in the establishment of modern community-based services, integration of mental health into general healthcare, creating information systems, and strengthening intersectoral coordination and international partnership. Along with the structural and governance changes, we made substantial investments in the development of the human capital in the field of mental health. We set up working places for clinical psychologists, social workers, and occupational therapists at mental health facilities. In addition, new training programs on mental health have been elaborated and implemented in our country. We have also made many efforts to improve the human rights protection of people with mental disabilities, as well as to tackle the stigma and discrimination accompanying mental health issues. Unfortunately, the COVID-19 pandemic has seized many initiatives related to the development of comprehensive, integrated, and responsive mental health and psychosocial care. With the rapid spread of the pandemic, our mental health system has been experiencing challenges with resources allocation, staffing, care provision, and service functioning in general. Furthermore, COVID-19 related stressors such as fear of infection, loss of loved ones, self-isolation, economic losses, work and school closure resulted in a surge of mental health problems. In addition, people with pre-existing psychiatric disorders, especially those with severe mental illnesses, had the lack of access to mental health care. The current situation requires new approaches to promote and safeguard mental well-being across the lifespan. We do realize that international cooperation is very much needed to that end. In this regard, we fully support the European Programme of Work's Mental Health Coalition flagship initiative for 2021-2025. We are convinced that our joint efforts will result in better prevention and management of mental health conditions and disabilities in the European region. Thank you for your attention.
Thank you, Azerbaijan. I would like to now give the floor to Portugal, please.
Dear WHO Regional Director, dear Ministers, ladies and gentlemen, good afternoon. Firstly, allow me to express my appreciation to the Regional Office for Europe of the World Health Organization, and in particular to its Regional Director, Dr. Hans Kluge, for this kind invitation. It is a pleasure to be able to deliver a few remarks on mental health challenges. Based on sound epidemiological data, we know that psychiatric disorders and mental health problems have become the main cause of disability and one of the main causes of morbidity and premature death, especially in the European region. It is undeniable that the COVID-19 pandemic and subsequent economic recession left a negative footprint on the mental health of European citizens. These side effects have been particularly impacting to some groups of society, namely the youth, the elderly, individuals who were already suffering from mental illness and substance abuse disorders, and healthcare professionals, in particular the ones working on the front line to fight the COVID-19 pandemic. Currently, governments and international organizations are addressing the area of mental health, focusing on two main topics: the burden on populations, which includes morbidity, mortality, and disabilities on the one hand, and the provision of care, which includes community models, quality, and costs on the other. Civil society has also given a strong impetus to this area, namely on human rights and citizenship issues, the fight against stigma, and the participation of patients and families in the decision-making process. Despite the great progress perceived in recent years, the situation in the European region is still uneven and mental health-related problems are prevailing. In this regard, I shall refer to the Lancet Commission, which considered that in the area of mental health, the disproportionate link between the available means and the unmet needs of the population was able to categorize all states as developing countries. In short, all adverse factors have contributed to the emergence of new challenges and needs of populations, thereby putting more pressure on member states to act and tackle these issues promptly. Because prevailing problems require pragmatic solutions, mental health services across Europe should adapt and change by getting closer to populations and also assuming a shared role in the delivery of care. In addition, there should be further investment to improve access to mental health services and also to implement programs of positive mental health promotion targeted at the general population. It is my firm belief that we should move far beyond outdated concepts and negative perspectives regarding mental disorders towards critical dimensions, focusing on the well-being, prevention, promotion, rehabilitation, recovery, and human rights. It is in this complex and multidimensional context that the importance of the mental health coalition becomes yet more evident. As the key instrument through which the European Framework for Action on Mental Health will work to achieve its priorities, the coalition will most certainly succeed in raising public awareness and promoting the exchange of knowledge and good practices amongst member states. It is only fair to say that the coalition may be the much-needed vehicle in our journey towards the improvement of mental health across Europe. Thank you very much for your time.
Thank you, Portugal. I have next on my list Greece, but I would like to ask you, Greece delegates, that do you still want to take floor, or did you enlist it on the speaker list because you agreed to take part in the panel discussion? And if you are still willing to take the floor, so you are pleased to take the floor here.
Yes, yes, thank you very much. I'm willing to take the floor. So, dear Regional Director, Dr. Kluge, dear colleagues, it is a genuine honor for me to be given the chance to support the WHO European Framework for Action on Mental Health and the new Mental Health Coalition. This framework is monumental because it revitalizes the effort to address long-standing challenges related to mental health that affected all mental health services delivery systems long before the pandemic, but have been made all the more evident in the aftermath of COVID-19. Therefore, the framework provides a new impetus for fighting stigma, elevating quality, showcase the importance of both prevention and management of mental health conditions, and support the integration of individuals suffering from mental illness within our social and economic structures. The Mental Health Coalition per se will guarantee the implementation of the framework in the most effective way. In an effort to support the work envisioned in the European Framework for Action, Greece has taken a series of steps to further reinforce mental health and service delivery, especially during these unprecedented times. The steps include psychological support through telecounseling via online communication applications for COVID-19 patients who are hospitalized or quarantined at home, for their family members, and for the health staff of our hospitals and community-based health facilities. Development also of a modern information system that ensures the collection and processing of data of the public-run mental health units and allows the dissemination of the information to the management and supervisory mechanisms. The creation of a digital map of mental health services that facilitates the citizens' access to mental health units, early intervention services in psychosis that we legislate for the first time and are under development, integration of mental health in primary healthcare with the development of a telepsychiatry network in the form of an integrated digital outpatient clinic in collaboration with the private and public sector. Also, development of psychiatrist services and community units for dementia patients throughout the country. Finally, the Athens Mental Health Summit was co-organized by WHO Europe and the Greek government last July. And during the summit, an important declaration was adopted on the actions needed to overcome the effects of the COVID-19 pandemic on mental health and the relevant services. In the same direction, we agreed with the regional director, Dr. Kluge, to support the development of the European Center of Excellence to serve all the member states and to showcase the best European practices in children and adolescents' mental health delivery systems across the pan-European region. Thank you for your attention.
Thank you, Chris. Now I would like to give the floor to Czechia, followed by Russian Federation and Croatia. Czechia, you have the floor.
Chair, Director General, Regional Director, distinguished delegates, ladies and gentlemen, the Czech Republic fully aligns itself with a statement delivered on behalf of the EU. In accordance with the presented resolution, WHO European Framework for Action on Mental Health 2021 till 2025, the Czech Republic currently perceives mental health as one of the most relevant and most challenging issues. COVID-19 pandemic has highlighted the importance of healthcare system resilience and readiness for response on health emergencies of such magnitude. But it has also brought our attention to shortcomings in the field of mental health. I'm delighted that the Czech Republic has begun with a psychiatric care reform, which represents a fundamental system change that, thanks to the WHO support, we are able to take big steps forward. The psychiatric care in the Czech Republic has not experienced any major systemic changes since the beginning of the 1990s. The current model of care does not provide sufficient support for patients in their own environment, nor does it ensure cooperation and coordination among individual components of mental health care providers. We have therefore started to work hard in order to change it. The general objective is to improve the quality of life of people with mental illness, issue that is closely related to basic human rights. Main tool for achieving this goal is establishment of mental health care facilities network, so-called mental health centers. As you can see in the country vignette, the Czech Republic prepared for this regional committee. Emphasis should be placed on primary care in such a way that the staff is able to diagnose patients in an early stage of their disease. The Czech Republic set up Government Council for Mental Health, chaired by the Prime Minister. This is a clear signal that we are serious about the psychiatric care reform in our country. We very much welcome the establishment of the Mental Health Coalition, and we are ready for further cooperation also via the WHO Collaborating Center for Public Mental Health Research and Service Development the Czech Republic hosts. Thank you for your attention.
Thank you, Czechia. And next, Russian Federation, followed by Croatia and Armenia. And I think that we still try to go through 5 statements before the break. So, Russian Federation, please, you have the floor. Russian Federation, we can't hear you. Are we getting connection now? Hello, Russian Federation? Okay, we then go to Croatia, followed by Armenia and Ukraine. Croatia, floor is yours.
Dear colleagues, the emergency of COVID-19 pandemic has affected us all in many ways, eventually leading to the disruption of regular daily activities. During this period, Croatia was additionally affected by 2 devastating earthquakes, which posed additional stress on the already burdened healthcare system and the society in general. Such crises require prompt response in terms of the efficient organization of civil society and the healthcare system. Special emphasis also needs to be given to the mental health of affected persons. In Croatia, the process of reorientation of the mental health care system started during the implementation of the twinning project named Ensuring Optimal Health Care for People with Mental Disorders, which was carried out in cooperation with Netherlands in 2016 and 2017. As a result of the project, several sets of guidelines have been developed, namely for early detection of mental disorders, community mental health care, child and adolescent psychiatry. The process of destigmatization of persons with mental disorders has been initiated, leading to an establishment of an umbrella association with Mental Disorders 2018. We are currently in the process of adopting strategic documents in the field of mental health. This strategic framework contains all crucial objectives contained in the initiative of Mental Health Coalition at the accompanying resolution. On another note, COVID-19 pandemic has accelerated the development of telemedicine services in Croatia in providing first aid and mental health protection during crisis times. Over 50 telephone lines for psychological assistance have been operating since the beginning of the pandemic in Croatia, and mobile psychiatric teams for community interventions have been established in the earthquake-affected areas. Finally, I would like to highlight that Croatia strongly supports the initiative of Mental Health Coalition and accepts related resolutions, which are fully in line with the strategic objective of the Croatian mental health care. Thank you.
Thank you, Croatia. Next, Armenia, followed by Ukraine and Belgium. Armenia, floor is yours.
Thank you very much. Dear colleagues, I take great pride to greet all of you of the 71st session of the WHO Regional Committee for Europe, and particularly those who joined under the agenda of mental health. Mental health is a viral concern in our changing world, given that mental health conditions now cause 1 in 5 lived with disabilities. But the importance of the area of mental health in public health is mostly underestimated, and thus does not drive attention of many policymakers and public health leaders. But now there is a momentum for the highest possible recognition of mental health. For the region in general, and for Armenia specifically, it is important to address the mental health conditions which are leading cause of suffering and disabilities. Priority areas of the addressed mental health fall out of the COVID-19 crisis. A surge of disease of despair, the persistent prevalence of depressive and anxiety disorders among young people, the growth of self-harm and suicide, and the unmet needs of people with dementia or autism spectrum disorders. Mental health becomes even more vital when people are facing emergencies like COVID-19, pandemic, or armed conflicts. Following the escalation of conflict in Nagorno-Karabakh on 27th of September 2020, there was a significant number of displaced populations, death and injury amongst both civilians and military personnel. This has rendered a high level of distress amongst affected and host population. This, coupled with the spike of COVID-19 infections and deaths, the emergency added pressure not only on a general public, but also on healthcare providers, including a need for psychosocial support of health workers and the need for supporting the resilience of communities affected by the conflict. The mental health and psychological support were an important part of Armenia's interagency response plan and continues to be priority for post-emergency period. The only early recovery is the main topic of post-conflict development. Reflected in policy strengthenings and operational frameworks of policymakers and multilateral institutions. Along with the multidisciplinary approach covering assistance, economic development, and peace building, it is very important to provide psychological support for people to recover, to stay in control of their lives, and build a resilience and control over problems. All countries have an obligation to invest in mental health, but it is particularly important in conflict-affected populations where the rate of mental health conditions is more than double that of the government population. As it is mentioned in European Framework for Action on mental health and psychological relief efforts should be an integral part of disaster preparedness and emergency response and recovery on governmental level, and it should be included in country emergency plans. Investing in mental health in frames of humanitarian response pays dividends, not just in helping people survive extreme distress and hardship, but also to support a nation's recovery. As mental health response is a vital element of individual and collective well-being, it is my pleasure to express my support and interest in the Mental Health Coalition launching on September 13th in Belgium, with participation of Her Majesty Queen Mathilde of Belgium. I believe that this event will become a bright example of champion coalition building in region and will boost mental health action in Europe. Thank you very much.
Thank you, Armenia. And we have now a connection to a Russian Federation, so I will give them now the floor, followed by Ukraine and Belgium. So, Russian Federation, the floor is yours.
Distinguished Regional Director, respected Chair, dear colleagues, please take my apologies. I had some technical problems. Let me continue in Russian. В настоящее время охрана
At present, mental health care is one of the most important medical social issues. It became even more important because of the novel coronavirus infection. The Russian Federation attaches to the issue of mental health particular attention. The work of the doctor is always linked to a risk to life, but during a pandemic, healthcare staff have encountered the need to treat patients with highly infectious diseases without the necessary medical drugs and also risking the lives of their close ones and themselves. Given the situation, there are a number of other factors being involved. The Russian Federation, we have standardized the access of population to mental and psychological assistance. We increased the access in the context of COVID-19 pandemic. The Russian Federation, from the beginning of the pandemic, set up 24-hour hotlines with the efficient medical and psychological assistance, including emergency assistance. Also, special methodological basis has been developed in regions of the Russian Federation. We have disseminated material on psychological mental assistance in COVID-19 context. We are developing and spreading advanced practices in this area and developing reactive mechanisms in the pandemic in order to develop more efficient approaches. We are introducing the best international practices, including the experience of the World Health Organization and foreign colleagues. Particular attention is being given to the provision of the relevant psychological assistance for medical staff. Medical institutions are conducting work on prevention, development, and further correction of the syndrome of emotional burnout of health staff. The WHO European Framework for Action Mental Health for 2021-2025 can become a good basis for resolving problems linked to mental health in the European region of the WHO. We share recommendations of the technical and consultative group on the impact of COVID-19 on mental health in the European region of WHO. These measures have almost been fully implemented by the Russian Federation. We would like to express our commitment to the declaration of ministers. We'd like to thank the WHO Office for the European region for organizing such an important event. We stand ready to continue joint work and exchange of experience, including as part of the Mental Health Coalition. We also support the draft resolution submitted. Thank you, colleagues, for your attention.
Thank you, Russian Federation. We will have next Ukraine, followed by Belgium, and then we take a healthy break and concentrate on breathing again, if I have right information here. But now first Ukraine, followed by Belgium. So Ukraine, floor is yours. Do we have Ukraine online? No. Let's try then later. So I now, okay, Ukraine is connected, so the floor is yours. There seems to be problems still, so Belgium, the floor is yours.
Thank you. Madam Chair, Mr. Regional Director, dear colleagues, Belgium fully aligns itself with the statement delivered by Slovenia on behalf of the European Union and its member states. We warmly welcome the European Framework for Action on Mental Health. In line with the Global WHO Action Plan, we value the strong focus on governance, on multidisciplinary and people-centered care, as well as on promotion and prevention. Belgium is very honored that Her Majesty Queen Mathilde is sponsoring the Mental Health Coalition. We hope that this coalition will contribute to fight against stigmatization of people with mental health issues. And as mentioned just before by Armenia, we as well look forward to the launch of the Mental Health Coalition at the end of this month. The COVID-19 pandemic has affected the mental health condition of many citizens, with potential long-term effects, especially on children and young people, and on the most vulnerable groups. Additional knowledge is needed to fully assess the impacts of the pandemic on mental health and well-being. We expect WHO to take an active role in filling these remaining gaps in data collection and research. We should also learn the lessons from this crisis to better respond to the next one. While authorities adopt public health measures to counter the spread of a virus, they should take into account the impact of this measure on mental health. We do believe that the guidance of the WHO is very useful in this respect, as for example, for the balanced approach recommended by the regional office regarding schools closure. More generally, we see education, but also social and family relationship, access to green spaces, physical activity or leisure, and access to preventive and social care as key protective factors for mental health. We should be safeguarded as much as possible in a human rights-based approach. But looking beyond this crisis, we believe we should also seize the opportunity to build back better. The pandemic has raised awareness about the importance of mental health, which can be a trigger to boost mental health literacy, but also the involvement of communities and first-line actors in prevention and early detection. This pandemic convinced us to pursue our efforts to bring mental health care closer to the citizens through deinstitutionalization, match care, and patient participation. In this regard, Belgium is looking forward to continuing its close technical cooperation with the WHO. Thank you.
Thank you, Belgium. It is time now for a pause, and I hand the floor to Executive Director Mr. Butler for some housekeeping messages.
Thank you, Madam Executive President. We're going to get ready now for a well-deserved healthy break that will take us through to 4:30. So we're granting you half an hour break. But before we go there, I'd like to invite you for a short with our breathologist, Steve Severinsen, who's back with us, our world-famous free diver, who will introduce us to some simple breathing techniques for relaxing and re-energizing. Welcome back.
Thank you so much. I should be unmuted and on screen. Yes, I see some people nodding, so I take that as a yes. Thank you, Russia. So I see one happy face. Let's get straight into the breathing, and just to follow up on our Belgian friends, I totally agree there needs to be more preventive intervention, much more healthy preventive care, and of course more natural, healthy rehabilitation. That's what we all should look for in this day and age of modern care and medicine, both physical and mental. But let's start again, maybe the new participants today. So 3 simple exercises I give you today. One is to relax in general. One is to get a little bit more energy, because I fully understand after long days, you need to also keep the energy high, and you need to make the right decisions that will affect millions of people around you. So these days are key that you're sharp, mentally clear. And then finally, we do a relaxation exercise that also ends as a unity breath. So we all come together in one breath. Okay, so it's fairly straightforward. First of all, let's focus on how we should breathe naturally. Most of you hopefully aware that you breathe about 20 to 30,000 times a day. Many of you are medical doctors. So 20 to 30,000 times a day, you have a chance to optimize your health, to breathe as naturally and deeply as possible. Natural breathing is through the nose. I said it yesterday. The nose is for breathing, the mouth is for eating. Okay, so let's start together. Breathe in with your nose. Slight pause and exhale, completely relaxed. The exhale can be through your mouth or through your nose. It's up to you. But inhale always through the nose. Use the natural filter, the natural capabilities of the nose to keep you healthy, away from viruses, bacteria, and fungus that I filtered out. Not all of it, but much of it. If you use the mouth, everything, pollution, virus, bacteria, everything that you don't want goes straight into your lungs, okay? All kinds of contamination. So it's a very, very important aspect to understand, especially for doctors and healthcare takers. So you sit straight up, give space for your heart. In a straight pose, open your chest, make room for the heart to beat, because the breathing has to be coordinated with the heart rate. That is how you optimize the delivery of oxygen to your body. So breathe in with me. Slight pause and just exhale. And try really to feel what's going on in your body. You are welcome to close your eyes and just listen to my instructions per voice. You don't have to see me. Look inside yourself if you want, at least for the last exercise. But once again, breathe in with the nose. Slight pause and exhale. Now understand there are 4 phases in breathing, right? Inhaling, phase 1, slight pause. Second phase, third phase, exhale, passively, just let it go. Let the shoulders go, any tension, you're all sitting at computers, let it all out. And then the 4th phase is the relaxation phase after the exhale and getting ready to turn the breath. Let's do it one more time together and understand that you can always use breathing sitting before a meeting, before a phone call, before any activity. When you're on a cab, on a ferry, on a train, on a flight, you can always use breathing as your best friend to stay mentally and physically fit, okay? Very overlooked. It's as simple as it seems, but yet not very used. Then we go to the next exercise. The next exercise is to energize you a little bit. And I welcome you today to actually use your body. I know you've been sitting for many, many hours in front of the desktop. That leads to tension in the shoulders, in the neck. The blood supply is constricted and you're not really your best self. I want you to be like your superhuman self, the optimal person you can be, okay? So let's breathe together in with the nose, and then we make a small resistance on the exhale, okay? So we breathe in. It's almost like you're running. But get the shoulders on, a little bit shoulder work, just to activate the body. That loosens up the shoulders, it opens the chest, and all the lymphatic fluid as well. You have the blood vessels, but you also have the lymphatic system. That is part of your immune system. Very important to keep it healthy and flexible, okay? Breathe in, slight pause, and then make this sound. Very good there. We have our friend here Romagosa, also yesterday, very active. Thank you very much. I like the activity here, the participation. Everyone again, breathe in. Shoulders, use them, of course, breathe into the belly, but activate the shoulders. So always use the belly, which is the lower part of the lungs. That's where you have the largest oxygen exchange with your blood vessels. And then natural exhale. Okay, some of you, I'm sitting here in southern Spain in my wonderful home. I can feel I'm starting to get warm. So you see now you activate the sympathetic part of your nervous system, the activating, the go-getter, the energizing breath, right? So with your breathing, you can move your mental and physical state in one breath. It's incredibly important to understand how efficient this is, yet very simple and overlooked in modern age. Thousands of years ago, they figured this out. We kind of forgot it, and it got lost in translation. Third exercise together is 1-2 breathing. This is my key go-to exercise. I call it Relax on Demand. I train the Navy SEALs in Denmark, in the US, the Danish Royal Air Force, people that need rehabilitation. And as I mentioned in the beginning, I'm very much pro prevention, smart interventions during illness challenges, but especially rehabilitation. Use your breathing to your best ability. We need to look at how we rebuild mechanical ventilation and everything, so we don't use the mouth, but the nose, because of the nitrogen oxide. It's a vasodilator. 3 scientists were given the Nobel Prize for this discovery, if you don't know. It opens the blood vessels, it brings more oxygen to your body, every single cell, okay? So breathe in and double the exhale. That is the exercise. Breathe in, slight pause, and then yes, I love this from Magosa. He's so active. I want all of you to use your body to feel the warmth in your face, to feel this amazing body you have. Use it or lose it, okay? I really want you to engage. What you do when you slow the exhale, besides of getting airflow control, you push more oxygen into your body, you also trigger the vagus nerve, the 10th cranial nerve. I know most of your doctors, so many of your doctors, the 10th cranial nerve is a key nerve. It sends roots into your heart, into your lungs, all your digestive organs. So what do you do with this slow exhale? You trigger the parasympathetic part of your nervous system, which leads to not only a more relaxed you, it leads to higher levels of cooperation and altruism. If you don't know what altruism means, it's a fancy word for being nice to other people without expecting anything in return, okay? So when you breathe in this way, you also change your mental outlook at the world and the way people look at you. So let's try together the last minute, breathe in unity. So we all try to follow my rhythm and make the double exhale about the same. So let's say 7 to 8 seconds. We can all do that. And put that big smile on your lips. It makes a huge difference to have a positive attitude. Let's do it together. Breathe in with your nose like you're smelling a rose. Slight pause, and then you exhale slowly, relaxed and controlled. Land the exhale, slightly turn the breath after the pause, and inhale again with me, and put a smile on your face. Stop, and slowly let the body go, let anything go you don't need in your life, any tension. And thank you for those of you closing your eyes. I invite you all to close the eyes on the last 2 breaths, and then we're finished with this little session. Close your eyes for your own sake. Go inside to look at your body. Feel your heart rate. Feel the pulsating heartbeat in your throat. Feel the warmth of the blood rushing in your body. And feel how you easily can center your mind and your thoughts around breathing. We take the last breath and then we're done. So all together from all nations and countries of the globe, hold it, big smile, and we all let it go in a positive exhale. And try to feel the difference now that you're more relaxed, you're warm in the skin, and you're ready to continue the day with a positive outlook. Thank you everyone for joining. Thank you for the invitation. I'm very honored, and I hope that you'll use breathing in a more proactive way, not only in your own life, but also in your clients' or patients' lives moving forward. Thank you very much.
Okay, welcome back, dear colleagues. We have still work to do today and tomorrow. And we continue discussing the agenda item number 6. Am I right? Yeah. And we have still here some member states who would like to give statements. And I have next here on my list UK, but I ask if Ukraine is connected. I would like to give floor then to Ukraine if we have connections. But UK now, then Ukraine if we have connection there, followed by Kazakhstan. So UK, you have the floor.
Thank you. As has been highlighted by the panel, the pandemic has had a disproportionate impact on people's mental health and well-being and has exacerbated existing inequalities. We welcome this paper on this critical issue, as well as the renewed focus on the importance of mental health services and prevention via the European Framework for Action on Mental Health and the establishment of the Mental Health Coalition. The UK recognises the need to invest in mental health recovery from COVID-19, including on the social determinants of mental health, which we agree, as others have said, should be a priority across member states. The NHS long-term plan looks at expanding and transforming mental health services in England and investing an additional £2.3 billion a year by 2024. But more was needed to be done to address the impacts of the pandemic. And we recognise that while we can continue to support the mental health impacts of social and economic determinants, cross-government support is necessary to fully tackle these issues. Last year, we therefore established a mental health and wellbeing ministerial task and finish group focused on addressing COVID impacts on mental health. This culminated in the publication of a mental health recovery action plan, outlining the approach we have taken in response to the pandemic and backed by an additional £500 million. This is specifically for the recovery from the pandemic and accelerating NHS mental health service expansion. The plan aims to respond to the pandemic and specifically targeting groups which have been most impacted, including those with severe mental health illness, young people and frontline staff. Part of this funding will be used for one-off initiatives to tackle the impacts and improve and reduce inequalities in mental health across our country, including in the most deprived areas. This funding has so far been used to support almost 250 interventions, including debt management advice and culturally competent bereavement support. In addition, we have introduced psychological first aid training, both for people who care for and work with children, and for frontline workers and volunteers. We welcome further action across member states on mental health and look forward to supporting the ongoing work through our participation in the Mental Health Coalition. Thank you.
Thank you, UK. Do we have connection to Ukraine? No. So next then Kazakhstan, followed by France.
Thank you so much. Уважаемый председатель,
Distinguished Chair,
огромное спасибо организаторам.
thank you very much to organizers for the agenda. After the vaccination issues, we tackled the issue of mental health, which is very significant. It highlights the relevance of this topic. The pandemic served as a catalyst of increased attention to mental health. The Mental Health Coalition is an important flagmanship program for the regional. The interpreter apologizes. The speaker is not audible. The coalition is fully supported by Kazakhstan. We support the main areas of the Mental Health Coalition and the framework.
Как часть общей европейской.
The country coalition should be part of the overall coalition, which will allow us to eliminate the borders between countries and bridge the gaps in the approach. Kazakhstan has started discussing the country coalition as well as its tasks and mandate. We think that the paradigm of its activity should be clearly set out. And access and approaches to mental health, it's important for the coalition to have not only mental health issues, but also NGOs, educational associations, but also new individuals who still do not think that they have anything to do with mental health. They are the ones who will be the drivers for decreasing stigmatization. We support and propose the following. Most importantly, an exchange of views at the regional level between the European region and other countries, ensuring monitoring, introducing initiatives in mental health, making it a part of the state agenda of various countries. Regular implementation of various initiatives. Depending on the country conditions, there should be a work agenda for the work of the coalition. So we'd like to recommend that this coalition should become a certain body. We should special rules should be developed. The interpreter apologizes. Speaker is not audible. Unified approaches to the implementation of country coalitions must be ensured. The tasks as set must be implemented in order to transfer best practices. Kazakhstan stands ready to cooperate on these issues. Thank you for your attention.
Thank you, Kazakhstan. There are some technical problems with the interpretation and the sound. They couldn't hear clearly, so there might have been then problems for translating their statement. I would like to now give floor to France, followed by Austria and Republic of Moldova. France, you have the floor.
Thank you. Do you hear me?
Yes.
Okay. So, Madam Chair, Dr. Hans Kluge, Excellencies, dear colleagues and dear delegates, I'm going on in French. It will be easier for me. Thank you. La France souscrit à la déclaration.
France supports the declaration made on behalf of the EU.
Santé globale. Il n'y a pas de santé sans santé.
There is no health without mental health.
Environnementaux.
The interpreter regrets that the sound quality is very poor.
Conditions de vie et de travail, la situation économique stressante, les inégalités sociales, les violences et les conflits. Dans la région européenne, les pathologies mentales et les états de souffrance psychique sont leaders en termes de prévalence, de coûts et de sources de handicap. La pandémie a aggravé la situation des personnes préalablement vulnérables, personnes atteintes de pathologies psychiatriques, de pathologies démentielles ou de troubles du spectre autistique. La crise sanitaire, par ses effets systémiques, a également révélé de nouvelles vulnérabilités des personnes et des systèmes de soins, faisant apparaître des chiffres inédits de prévalence d'anxiété, de dépression, de troubles du sommeil, d'addiction dans l'ensemble de la population et de troubles du conduite alimentaire chez les préadolescents. Dès le début de la crise, en mars 2020, le secteur spécialisé en santé mentale et en psychiatrie a su remarquablement faire face aux contraintes imposées par la situation sanitaire en adoptant très rapidement de nouvelles modalités d'organisation. La crise de la Covid-19 a ainsi accéléré les réorganisations et les innovations au cœur des stratégies de la santé mentale, soutenues financièrement avec une mobilisation renforcée de tous les acteurs de la santé mentale. Avec la crise de la Covid-19, la santé mentale est passée au premier plan des préoccupations et nécessite de ce fait des engagements renforcés au niveau national et international. La coalition en santé mentale pourra s'employer en particulier à lutter contre la stigmatisation et la discrimination en développant la littératie en santé mentale. Elle pourra plaidoyer également en faveur de la réforme des services afin que les soins de santé mentale dispensés dans tous les États membres puissent évoluer conformément aux valeurs de la région européenne et aux grands textes internationaux, notamment basés sur un programme de la prise en charge orienté vers le rétablissement, la promotion du pouvoir d'agir des personnes concerner des familles, l'accès au logement et au travail, la promotion de la préparedness et du savoir expérientiel et l'implication des usagers dans les instances décisionnelles locales et nationales. Nous sommes convaincus que la coopération transnationale et le partage d'expériences peuvent être un moyen puissant de déclencher une mobilisation nationale en faveur des réformes et de leur mise en œuvre. C'est pourquoi la France soutient clairement les initiatives internationales à décliner au niveau régional, national et local, et donc notamment la coalition en santé mentale. Elle s'est ainsi engagée pour organiser les 5 et 6 octobre prochains, avec le soutien de l'OMS, un sommet mondial sur la santé mentale. Mind Our Rights Now. Merci, thank you. Спасибо большое за внимание.
Okay, thank you, France. And we seem to have now problems with the translation, and it is in Geneva where our interpreters are. They have noise on the lines, so it's not only the English channel, but there are also on other channels problems now which are trying to be now corrected. So I apologize that we couldn't get translation into English and only partially in other languages here. But let's try to go on and we try to solve here the problem so that you could also have the country's statements available broadly. I would now like to give the floor to Austria and then followed by Republic of Moldova and Israel. Let's see how the quality of the sound is. But Austria, your turn, please.
Thank you, dear Chairwoman, dear colleagues. Austria aligns itself with the statement delivered by Slovenia on behalf of the European Union and its member states. And yes, mental health is an essential part of overall health and has a vital role in political decision-making, especially in times of COVID-19 crisis. Austria thanks the regional office for presenting the comprehensive documentation and fully supports the priorities of the mental health monitoring and implementation framework in the European region. And I am totally with our regional director. Many challenges regarding mental health can't be solved and fixed without a strong and interdisciplinary primary health care services. And that's very much true, especially after this pandemic crisis, because several national and international studies show that the quality of life and mental health of children and adolescents have deteriorated further in the course of the pandemic. Almost every third child shows mental health problems such as anxiety and worry, depressive symptoms, and psychosomatic complaints. Health behaviors also deteriorated in the last many months. So these investments I talked earlier in primary health care are also investments in mental health, and I'm very happy that our government will spend several hundred millions of euros to strengthen the primary health care facilities. These investments are timely and urgent. Experiences from other crises prove that we reach the peak of the psychosocial stress only after the causal crisis has subsided. Therefore, we can assume that the psychosocial consequences of the crisis will last even longer. In addition to numerous low-threshold measures in various sectors, there's also a need for very concrete counseling and treatment offers for those affected, as well as investments in psychological care. Global and European action plans are important foundations to strengthen the implementation of such initiatives at national level, and we welcome the Alliance for Mental Health, which, in the spirit of the EPW global approach, is managed as an open process that responds to global and regional development as well as to emergency and crisis. Thank you very much, and I yield back to you, dear Chairwoman.
Thank you, Austria. I now we are trying to get then both France and Kazakhstan to make their statements after the list of the speakers here I have and we showed you is over. So now I have on my list Republic of Moldova, Israel, Albania, Denmark, and Finland. And after that, we are going to take Kazakhstan and France. So now the floor goes to Republic of Moldova, followed by Israel and Albania. Please.
Dear Regional Director, distinguished guests, ladies and gentlemen, the government of the Republic of Moldova, through the Ministry of Health that I have the honor to represent, welcomes the launch of EPW Mental Health Coalition flagship initiative and aligns itself to the EU statement. This initiative is based on the work of Technical Advisory Group on the impact of COVID-19 on mental health, established by WHO Office for Europe, and the Republic of Moldova was actively contributed to the work of this group by co-chairing it. This is an example of strong collaboration of the Republic of Moldova with the international health community and with WHO in particular, by both sharing our national expertise in the technical advisory initiatives and by benefiting from the best practices and evidence-based recommendations developed by the WHO globally. Consequently, WHO Technical Advisory Group recommendations, such as interventions in mental health related to public health crises, will be included in the fourth generation of the National Mental Health Program of the Republic of Moldova, which is now in the process of development. This program will be in line with the WHO European Program of Work 2020-2025. The Republic of Moldova during the last 10 years has made significant progress in improving the legislative framework related to the mental health and implementing 3 consecutive national mental health programs towards a community-based service model. In our way to implementing this reform, we successfully reached the second phase due to the support offered by the government of Switzerland through the Swiss Agency for Development and Cooperation in Moldova and WHO Regional Office for Europe Mental Health Program. COVID-19 is a serious challenge for mental health program. Enforcement of unprecedented containment and mitigation measures aimed at preventing and controlling the spread of epidemic in population increased psychosocial needs of the population at large and the needs of specific affected groups. Since the beginning of pandemic in April 2020, the Republic of Moldova has mobilized important mental health intervention and psycho-emotional support for the first-line healthcare workers. All psychologists from the mental health services, prisons, schools, and youth-friendly centers across the country have been trained to be able to intervene in the case of burnout syndrome and to be able to provide psycho-emotional support. Regional Director, colleagues, the Republic of Moldova is fully supporting the Mental Health Coalition and is expressing its deepest gratitude to WHO for the support and guidance, and we are looking forward to continue this noble cooperation in the field of mental health services, strengthening the COVID-19 pandemic and beyond. Thank you.
Thank you, Republic of Moldova. Now, Israel, you have the floor, followed by Albania and Denmark. Israel, floor is yours.
Can you hear me? Regional Director, State Representative and colleagues, mental health was a neglected issue for far too long, and the State of Israel supports WHO and the regional sense of ensuring that mental health gets its place in the forefront of our discussion, especially during COVID-19 pandemic, which had such a negative impact on mental health worldwide. One of the greatest challenges of this pandemic has been the state and mental health people have suffered due to fatigue, uncertainty, and isolation. It is crucial to recognize that the pandemic has not only taken its toll of those 1 billion globally with mental health disorder, but also on the general public. This is one of the many reasons of WHO work during COVID-19 has been critical for health systems everywhere. One, on the national and the regional and the global level, we must not forget our duty to ensure that mental health and well-being is properly addressed in our pandemic response. We support the recommendations and the actions of the regional committee, specifically to apply whole of society approach to promote, protect, and care of mental health. We in Israel have been especially grateful to the social workers, psychologists, nurses, doctors who have been integrated in granting mental health care where needed, but also to civil societies, volunteers who had afforded themselves in this course. Lastly, one of the most important lessons to be learned from the COVID-19 pandemic is to strengthen services for the future. And for that reason, we support the recommendation to build a strategical mental health services to ensure those services are available and properly budget at all levels, from community to hospitals, and be part of the care of universal health coverage package for equal access and high quality for all of our population. Thank you very much.
Thank you, Israel. Now I would like to give the floor to Albania, followed by Denmark and Finland. Albania, you have the floor.
Thank you, Madam Chair, Honorable Regional Director, distinguished participants. It is an honor for me to address today's session on behalf of the Albanian delegation. As Dr. Hans Kluge pointed out yesterday, mental health is a key issue of primary health care to be tackled through global to local action, especially throughout the current pandemic. Albania has been going through two humanitarian emergencies in the last 2 years: the disastrous earthquake in November 2019 and the COVID-19 pandemic. Both emergencies have taken a huge toll on many people's mental health. Many struggled with deprivation accompanied by stress and anxiety that came in the first wave of lockdown. Many others were and are still worried about the emotional impact that loss of family members and loved ones would have on them and their friends. Others found it hard to deal with grief and isolation simultaneously present in their lives. Many others had difficulties in dealing with some other consequences of the pandemic and accompanying lockdowns, including job loss and financial insecurity. Now that public life has gradually begun to return to some normalcy, mental health experts warn that there may be a PSD-like lingering effect for some vulnerable groups, either from the loss of loved ones, extended isolation, or the exacerbation of underlying mental health issues. Immediately after the earthquake, our authorities asked for support and coordinated efforts with international as well as local organizations and institutions in order to provide emergency mental health interventions and to prepare mental health services and staff for the possible long-term mental health consequences of the pandemic. WHO has been a precious and loyal partner in these efforts, providing support through consultancy, up-to-date specific communication tools, and trainings for the mental health professionals. Such support would be needed to continue not only to strengthen the existing mental health system of the country, which in creative ways, as portrayed in the video clip we followed, have continued to provide essential mental health services for the population, but also to equip the mental health professionals with state-of-the-art instruments and knowledge so they can properly deal with the long-term complications and consequences of the pandemic. One of the main priorities of the government of Albania is the digitalization of the health services. In this framework, the Albanian Ministry of Health and Social Protection is working to develop online platforms able of delivering services, thus enabling equipment of professionals and healthcare workers, as well as increasing access to services. And I thank you for your attention.
Thank you, Albania. Next, I give the floor to Denmark, followed by Finland and Spain. Denmark, the floor is yours.
Thank you, Madam President. Denmark aligns itself with the statement made on behalf of the EU member states. Good mental health and well-being is essential for human life, as well as in the terms of resilience against health crises. Denmark therefore strongly supports the ongoing work of the Comprehensive Mental Health Action Plan, and we welcome the great flagship initiative on the Mental Health Coalition. It is evident that the COVID-19 pandemic has affected our mental health and well-being and has been especially challenging for those already struggling. We have to recognize the need to advocate for and to ensure mental health, especially in times of crises. Furthermore, we must not neglect already existing patients or lose our focus once the crisis is averted. Mental health is one of the most neglected areas of health. At the same time, we often fail to address the large correlation between NCDs and mental health. By failing to do so, we risk putting a greater burden on future generations. These are challenging times. We also face challenging times in Denmark. We will therefore launch an ambitious and comprehensive 10-year mental health plan to improve prevention and treatment of mental disease. Ensuring accessible and high-quality mental health services, free of stigma and discrimination. This is key to achieving universal health coverage. We must make use of the current momentum in order to strengthen our efforts in mental health to ensure that we leave no one behind. Thank you.
Thank you, Denmark. Now I will give the floor to Finland, followed by Spain and Kazakhstan if we have them online. So Finland, you have the floor.
Thank you, Madam Chair. Regional Director, Excellencies, ladies and gentlemen. Finland aligns herself with a statement of the European Union and its member states. Finland strongly supports the European Framework for Action on Mental Health 21-25 and its strategic priorities and the upcoming Mental Health Coalition. Mental health challenges have been substantial even before COVID-19 pandemic, but the importance of good mental health as a key resource for individuals and societies has increased. It's important that the framework covers both aspects, mental health as a resource and the prevention of mental health problems, in addition to development of mental health services. There is a strong need to place mental health at the center of recovery. We need to ensure access to mental health services at all phases of the pandemic. But we must also identify and assess the negative impacts of a pandemic on mental health, including those related to fear and uncertainty, especially concerning people with previous mental health disorders, people who are unemployed or losing livelihood, young adults, older people, and other groups that are particularly impacted, including healthcare professionals. In Finland, the economy of well-being approach has been considered important in supporting decision-making during a pandemic. We believe that it's possible to promote well-being, protect the vulnerable, and at the same time ensure the functioning of the economy and the society. We are continuously evaluating the social and economic consequences of restrictive measures and possible service disruptions to minimize negative impact. The economy of well-being underlines the necessity for better cross-sectoral collaboration and coordination, which is essential also in supporting mental health. The Mental Health Coalition can be a key instrument in achieving the objectives of a European framework for action on mental health. Finally, it's crucial to develop our knowledge base. We need well-founded frameworks to measure and follow the developments of mental health of the whole population and of different population groups. Thank you.
Thank you, Finland. I have on my list now Spain, Kazakhstan, France, and then Slovakia. If you would like to have then make your statement, please raise your hand on the Zoom platform. Otherwise, I will close the list soon. But now I will give the floor to Spain, followed by Kazakhstan and France.
Chair, dear colleagues, Spain aligns with the European Union at its member state statement. My country supports the draft resolution WHO European Framework for Action on Mental Health 2021-2025. Spain is committed to improve mental health, and it is in fact one of the main priorities for the Spanish Ministry of Health. We have been working in a national strategy and an action plan in which we are taking into account the views of all the interested parties, scientific societies, policymakers, and of course, patient associations. This strategy is mainly oriented on the rights of the person with mental illness, their social integration, the importance of fighting mental health stigma, as well as prevention of suicidal behavior and the mental health recovery of the person. The main lines we are working on are focused on patient autonomy and rights, the promotion of the mental health of the population, and prevention of mental illness, as well as early detection and attention to suicidal behavior. With regards to specific groups of populations, we are paying special attention to children and adolescents. I would also like to highlight that we have started a study on the impact of COVID-19 on mental health at national level to measure this impact. We are also focusing in research, innovation and knowledge in order to ensure promotion of rights in mental health services and recovery-based approaches. Spain support the upcoming WHO Mental Health Coalition. Thank you, Chair.
Thank you, Spain. I would now give the floor to Kazakhstan, followed by France and Slovakia. Do we have connection to Kazakhstan?
Yes. Thank you so much. Уважаемый председатель.
Distinguished Chair, distinguished participants of the 71st session of the Regional Committee. A great thank you to the organizers for the agenda that after immunization we are addressing the issues of mental health. This is very important and highlights the relevance of this issue. It's important to say that the pandemic turned out to be a catalyst for increased attention to mental issues. The Mental Health Coalition is an important initiative of the Regional Office of Europe, which is fully supported by Kazakhstan. We consider this initiative as timely and necessary. We support the main areas of the European Framework for Action on Mental Health. We also support to set up country coalitions as a part of the overall European coalition. This will allow us to eliminate the borders between those who deal with mental health issues and decrease the gaps in approaches. In Kazakhstan, we already started discussing the establishment of a country coalition as well as its goals. We consider it necessary to set out clearly the paradigm of its work and how we can change access to mental health issues. It's important for the coalition to have not only health, education, patients, non-governmental organizations, and public opinion leaders, but also new individuals who did not believe that they could be somehow linked to mental health issues. We think once they are convinced, they will become the drivers for decreased stigmatization. We support the following areas: exchange of opinions in the European region with other countries, establishing a periodic monitoring, introducing new initiatives in mental health, making it a part of state agenda, and ensure the implementation of various initiatives. Depending on country conditions, there should be some sort of regulations for the coalition. So we should recommend that this coalition should become a sort of working body. We think it necessary to develop a framework qualificational requirements for the coalition to ensure a balance between the various representatives. There must be unified approaches to the creation of country coalitions, cross-country evaluation and assessment of tasks and implementation of mental issues in various countries should be used to ensure transfer of best practices. This is not an exhaustive list of all topics that should be addressed. We stand ready to participate in the discussion of these issues. Thank you.
Thank you, Kazakhstan. And now France, followed by Slovakia.
Okay, so can you hear me now?
Yes, I can hear you, but I don't know if the interpreters have still noise.
No, I don't need it. I am sorry. Thank you to give me the ability to tell the statement of France again. I will tell it in English.
Okay, thank you. Go ahead. Now we lost you.
Yeah, sorry.
Okay.
I'm coming. I'm coming. It's okay.
Mental
health is a major determinant of global health. There is no health without mental health. Is it okay like that? Yes. Mental health can be compromised by psychiatric pathologies, but also by many environmental or developmental factors. Adversity during childhood and adolescence, living and working conditions, stressful or unfavorable economic situation, social inequalities, violence, and conflicts. In the European region, mental illnesses and states of psychological suffering are leaders in terms of prevalence, cost, and source of disability. The pandemic has worsened the situation of previously vulnerable people with psychiatric pathologies, dementia, or autism spectrum disorders. The health crisis, through its systemic effects, has also revealed new vulnerabilities of individuals and healthcare systems, revealing unprecedented abuse for the prevalence of anxiety, depression, sleep disorders, addiction in the general population, in eating disorders in pre-adolescents. From the beginning of the crisis in March 2020, the sector specialized in mental health and psychiatry was able to remarkably cope with the constraints imposed by the health situation by very
France, honorable delegates from France, I'm sorry we don't have any translation in any language here because there is a problem with the noise coming from your microphone there.
I'm sorry, I don't have any other microphone, so I can go on in English and then I will send you by mail and then you can translate.
Go ahead. Thank you.
And I can send in French, in English or Russian, and so you can give it to all the other delegations. So can I finish my
Yes, you can, and
not?
thank you that you will then send those.
Necessary, I can send the statement in 3 languages. So
thank you. That would be most valuable. Thank you.
From the beginning of the COVID-19 crisis has thus accelerated the reorganizations and innovations at the center of mental health strategies, financially supported with the reinforced mobilization of all mental health actors. With the COVID-19 crisis, mental health has moved to the forefront of the agenda and therefore requires strengthened commitments at the national and international levels. The Mental Health Coalition should work to combat stigma and discrimination by developing mental health literacy. It can advocate also for mental health services reform so that mental health care in all member states can be developed in line with European values and major international issues, notably based on a recovery-oriented care program, the promotion of the power to act of the persons concerned and their families, access to housing and work, promotion of peer support and experiential knowledge, involvement of users in local and national decision-making bodies. We are convinced that transnational cooperation and the sharing of experiences can be a powerful way to trigger national mobilization for reforms and then implementation. This is why France clearly supports international initiatives at the regional, national, and local levels. Thank you. Merci.
Thank you. Merci, France. And now last on my list is Slovenia. I will give you the floor, please. Slovakia. I apologize.
Dear Madam Chair, Slovakia aligns itself with the EU statement delivered by Slovenia. I am pleased to add few remarks. With these critical times, the mental health brings us not only challenges, but also opportunities. The Irish dance group at the opening of our session showed us a wonderfully moving way to achieve the youth engagement in mental health prevention and inclusiveness. It is foremost a comprehensive approach and the need to create sustainable and accessible prevention services and support, which has the potential to make a difference. We should not forget, especially the children, students, teachers, but also the healthcare professionals who have been affected the most. By our lesson learned in this field, we perceive the need to develop cultural and age-appropriate schooling mental health tools in order to prevent stress and various trauma more effectively. Alongside, it is necessary to prevent the development of social pathology among youth in relation to domestic violence, unstable environments, lack of opportunities for creative growth, protection and safety. We highly value and support the activity of the Regional Directors Team on the Mental Health Alliance and call for regional and national implementation to take further steps on children's mental health, collecting data with new and appropriate sets of indicators to better understand background of social, cultural, state, school and individual determinants of mental health with a view of improving it as soon as possible. Thank you.
Thank you, Slovakia. As there are no more no more delegates asking for the floor, I would like now to give the floor to observers. The Secretariat has received requests from following partner organization, one there to take the floor. So Northern Dimensions Partnership in Public Health and Social Well-being, Ms. Ulla-Karin Nurm, you have the floor.
Thank you. Honorable Chair, Regional Director, distinguished delegates, ladies and gentlemen. The NDPHS welcomes the establishment of the Mental Health Coalition and is ready to support its work. Mental health throughout life course is one of the horizontal themes of the new NDPHS strategy to be adopted later this year. We particularly welcome the focus of the European framework for action on mental health on older people, children, adolescents and youth, which are the priority target groups of our partnership. Within our flagship initiative on healthy and active aging, Age Flag, we have identified several areas that we want to work on to achieve better mental well-being of older people. These include the promotion of intergenerational dialogue, increasing positive public attitudes, and reducing ageism and self-ageism, as well as promotion of inclusivity and participation of older people in the design of service and policy making. Mental health of young people is also a topic that is important for our partnership, and we have established cooperation with the Baltic Sea Youth Platform to better include the perspective of young people in our work. Young people say that COVID-19 has been devastating to their well-being, but stress that there are other challenges that are causing great anxiety for them, the climate crisis being one of the biggest. I would like to underline that we are committed to leaving no one behind, and we will work on promotion of mental health of other population groups, such as people in detention. We also welcome and support the call to work across sectors and believe that mental health is an area where cross-sectoral cooperation is especially valuable. We are very much committed to transform attitudes about mental health and well-being, and we are seeking for further possibilities to reach out to the communities and engage non-traditional partners. Currently, we are working on exploring the benefits of arts for health and well-being and are piloting several initiatives, most of which address mental health improvement through art forms such as music, dance, theatre, photography, creative arts and design. I would like to thank you for your attention and once more to express support to the Mental Health Coalition.
And we have no other requests from partners, international organizations. So we move to the non-state actors, and we have there one joint statement which will be delivered by Mental Health Europe, if I have understood right. A joint statement by EuroHealthNet, World Federation of Occupational Therapists, and Alzheimer Europe, as well as Mental Health Europe. So please, the floor is yours.
Thank you very much, dear Madam Chair, Mr. President, Regional Director, Honorable Ministers, distinguished delegates, dear colleagues. We welcome and applaud the efforts by the Regional Office for Europe to mainstream and prioritize mental health in the WHO European region through the European Framework for Action on Mental Health and the new Mental Health Coalition. The World Federation of Occupational Therapists, Alzheimer Europe, EuroHealthNet, and Mental Health Europe would like to take the opportunity to collectively voice the importance of prioritizing mental health by investment in mental health services and placing mental health at the heart of the post-COVID-19 recovery agenda. In the European region, mental health problems are considered the leading cause of disability. Whilst the COVID-19 pandemic has certainly exacerbated the challenges, it has exponentially unmasked the failure to integrate mental health into the preparedness for, response to, and recovery from crises and emergencies. The increase in mental health problems has also indicated the need for mental health to be given equal priority to physical health, since both are equally important to components of overall health. We urge the following considerations be embedded to guarantee mental health is effectively prioritized in the recovery process. Ensure the involvement of all relevant stakeholders in the development of an implementation and monitoring framework for mental health promotion, protection, and care in the region. This should be carried out through meaningful and continuous involvements of key experts and communities to support the design and exchange of evidence-based interventions. Where possible, ensure all impacted groups are represented in the Mental Health Coalition, including persons with lived experience, families, and informal mental health carers. Monitor health inequities and ensure that all individuals can access information and quality health services when and where they need them. Ensure a psychosocial approach to mental health remains at the heart of work around mental health to support increased adoption of the psychosocial model in mental health promotion and care. The Mental Health Coalition should provide space for dialogue on innovative mental health awareness and literacy, as well as collaboration with policymakers, funders, health and care providers, and civil society organizations, and mobilize funds for comprehensive and innovative mental health reforms that include mental health promotion. Furthermore, Alzheimer's disease and dementia account for approximately 10 million people in the WHO Europe region and are expected to double by 2050. As such, we also wish to highlight that mental health under the WHO structure incorporates illnesses such as Alzheimer's disease and dementia. The work of the Mental Health Coalition flagship program should include dedicated measures and resources to ensure that Alzheimer's disease, dementia, and other conditions are not overlooked. I encourage you to read the full statement on the WHO Europe website for more of our recommendations. And to conclude, alongside our members, we stand firmly ready to support the implementation of the WHO European Framework for Action on Mental Health, and will work tirelessly to realize the potential of the Mental Health Coalition. We thank WHO Europe and member states for listening to our joint statement and look forward to working with you.
Thank you all for your strong commitment and valuable insight and advice on this very important issue. As there have been a number of comments made and specific questions raised in the interventions, I will now ask the Regional Director if he may wish to take the floor. Dr. Klug.
Thank you, Executive President. Indeed, I would like to wish to take the floor for a very short reply. The main point to express very sincere appreciation to all the member states who expressed support for the framework. Frankly speaking, this is overwhelming and what we had hoped for. Support for the framework, but also the Mental Health Coalition and the resolution. So there is no doubt at all that we must place mental health at the heart of the recovery. Finland kicked off with that one in the intervention, and then Austria was mentioning that the mental health impacts often long outlive the insult, in this case the virus. So this is a time to step up our efforts, not least as stated by Israel, in terms of our investment in mental health services. I really have to thank Greece for the phenomenal Athens Mental Health Summit, 22-23 July. I was there myself, participating throughout, and congratulations to the Deputy Minister, Ms. Rapti, but also to your Prime Minister, who spent quite some time, and the Vice President of the European Commission, Mr. Shinas. And this is so crucial because what we want to do is to take mental health out of the dark corner where it is stigmatized and put it in the heart of the recovery. I am very, very inspired and impressed by your announcement, Deputy Minister Rapti, for a WHO Center of Excellence with the dissemination or for dissemination of good practices on the needs of children and adolescents, and to provide the resources for this. All countries will benefit for this because the topic was mentioned by many countries, including Turkey and Belgium. We discussed about the mental health services of young people in Athens, but also throughout the life course. And I think this was mentioned also by Mental Health Europe. We have to think also of the older persons, and then Alzheimer and dementia, and we're also in touch with the European associations. I congratulate France, the Republic of France, for the upcoming Global Mental Health Summit and for the call for international cooperation in mental health. La France, je vous remercie. I received the invitation.
Thank you, France.
To have a spot explaining and presenting the Athens Mental Health Summit declaration. So we're really linking the regional and the global summits. I thank Neil. Thank you, Neil, for your inspiring words that invite all of us for reflection, as well as Mental Health Europe for the emphasis on the need for closer collaboration with civil society. I will take away your words, Neil. You're telling people want to help people, but they need help. How? I think that's very powerful because it's true. People want to help people, but we have to exchange how. Because the best way to tackle any mental health is to care for each other, is to help people. I welcome the strong support for the work expressed by the Slovenian presidency on behalf of the EU and the associated countries, and we took very good note of your support to the framework for action, and I'm particularly glad to hear how you collectively see the Pan-European Mental Health Coalition as the key to implementation of the framework. Very delighted also to note the support for the Mental Health Data Lab for measurable interventions, as highlighted by Spain and Finland, but also in my bilateral discussions before summer with the Deputy Prime Minister of Belgium, Minister Van den Broeke. And that's very important because, again, what gets measured gets done. Otherwise, we are shooting our bullets in the dark. I would like to acknowledge the importance of the partnership, and I'm ever so grateful to the Queen of all Belgians, despite of her very, very busy schedule, for confirming participation at the launch of the coalition at the Librairie Solvay in Brussels, 30 September in the morning. Thank you, Kazakhstan, for the support to develop a national mental health coalition for national level actions. You clearly concur that mental health policies and services should be designed based on evidence, Moldova mentioned, and adapt and change to meet emerging population needs, including addressing inequalities, Spain and including investment plans, Dr. Søren Brøstrum from Denmark. Mental health services should be delivered by interdisciplinary teams, but they need adequate capacity and support, Albania highlighted. Integration of mental health into general healthcare is critical to ensure parity of esteem between physical and mental health services, and to overcome stigma and discrimination, Azerbaijan. As Portugal and many others said, we need to move away from focusing on treating mental disorders to move towards prevention. And this will be a priority for the coalition, the prevention. And we also need to ensure the Czech Republic told the minister that we work to improve the quality of life for persons with chronic mental illness. COVID exposed health workers to vulnerabilities, and we heard from the Russian Federation on the needed action to address burnout among the health workforce. Incredibly important. And we have to speak about this. It's not shameful. It's happening. And in fact, the one big thing I took away from the Athens Mental Health Summit, where the technical advisory group was reporting the findings of the impact on COVID-19 on mental health, was that everyone is vulnerable. So even if you don't have a history, everyone. So no one should tell that he or she is immune, which means we all have to take it very seriously and there is no place for any stigma. COVID has shown us the importance of strengthening mental health services for emergency and crisis situations. We do not know when or where the next emergency will arise, but we know that we must do better. Croatia mentioned the earthquakes, Armenia mentioned Israel and Albania. Finally, we need to mainstream mental health in all policies. Belgium. Protective factors, green spaces. Remember, is one of the signature initiatives that the NCD coalition came up with. Green cities, good education, family support, leisure. The pandemic has really taught us what is important for our mental health, because the absence of social interactions has affected us all. We, my team and I, are energized and reassured of your support, really. The overwhelming support is a chance to have the whole region walk at the same pace, but also puts us into the global developments by aligning us with the Global Mental Health Action Plan. And thank you to the Northern Dimension Partnership and Mental Health Europe for the interventions. Your support gives us great confidence, but also a great responsibility. Let us work together to bring mental health out of the shadows. Thank you.
Thank you, Dr. Kluge. Colleagues, we are doing great progression and being effective by considering now adopting of the third draft resolution today. The draft resolution contained in EU/RC71/conf/doc/8 draft resolution on the WHO European Framework for Action on Mental Health 2021 to 2025. Is the committee willing to adopt the proposed draft resolution by consensus? I see no objection, so the resolution is therefore adopted. Thank you. With this, I close agenda item 7.